use her husband's name, you should use her father's name. But you are confusing the situation. So we have to now, that was when we were able to, if we have not communicated properly with her, we'll still be searching who is the owner of that blood because she has used two names. So effective communication is very key. So we now have to communicate to the laboratory to get the correct blood. Then critical thinking. Analyze patient's data, identify concern and develop appropriate care plan. When you analyze the data, maybe the patient history, past history, you'll be able to analyze that. Then you think properly, then equally as you discuss with the patient, you're able to, identify her concern, and then you now develop appropriate care plan that help the patient in quick recovery. Then prioritization. You prioritize patients' needs and manage time effectively during the wardround. And this is telling you that you don't have to take uh, much time as you are conducting the wardround. If you are having many patients, you don't just go and stay on a particular patient and waste much time. You have to prioritize your time and then prioritize other patients' needs. There are other patients that are waiting for you. You should not waste much time on one particular patient discussing. Emotional intelligence demonstrates empathy, compassion, and understanding while interacting with the patient and family. You know, the hospital is the last resort of most of the patients. Probably they have, spent a lot of money on traditional medicine, and some madams might have probably, eaten their money collected and, ate their money, but they've not gotten any relief. So they now have to come to hospital. Now, since they're in the hospital, you now have to first of all show empathy. You empathize with them, and then show your compassion. They will open up to you, and then if they open up to you, your show of empathy and compassion and understanding will go a long way in allaying their fear and calming them down, so that whatever treatment that is going to be given to them will now be of great use to them. Now, benefit of ward rounds. What are the benefits of ward round to the patient? We've earlier mentioned what the importance of ward round. Now, let us look at the benefit of the ward round to the patient. One, it improves patient's outcome. Timely intervention and care plans can improve patient outcomes and reduce complications, which would equally reduce the time that the patient was spent in the hospital. Two, enhance patient satisfaction. Patients and families feel informed and supported and involved in their care. With the kind of, when you carry out this word round, discussing with the patient and then the patient relatives, they will feel that yes, you are really sympathizing with their situation, and then that knowledge alone that these people really care for my health is kind of go a long way in assuring the patient that they are going to receive the best of care. Then three, it increases efficiency. Effective word round can streamline care, reduce error, and improve communication among healthcare team. Now, maybe as we are carrying out the word round, there is continuity in care that is being given. Probably in one particular shift, an error has been committed by your colleague. During word round, you'll be able to detect that error and make sure you correct that error and call the person involved to make sure that error has been corrected. We even have a situation where uh, after surgery, in surgical world, we've had a scenario like that. After surgery, analgesia where the surgeon has prescribed analgesia and then some antibiotic. When one senior colleague moved around to look at the patient's chart, she discovered that the patient analgesia has not been served since the patient has returned to the ward or the antibiotic. Now, if for 2 days. If ward round has been carried out, such thing, if the ward in charge had carried out ward round, such thing wouldn't have happened. So uh, that means the ward round increases efficiency. Then comprehensive assessment, evaluation of patient physical, psychological, and emotional needs. During one round, you'll be able to, you know, assess this patient comprehensively, physically, psychologically, and their emotional needs, just like we've mentioned earlier on. Now, note the role of the nurse during doctor's ward round. Now, after conducting your own ward round, now your role during the doctor's ward round. Like we earlier said, the role of the nurse's ward round is complementary to that of the doctor. We are all aiming at one goal, that is quality health care to the patient under our care. So, and the totality of the health professionals in the hospital are all geared towards ensuring that the patient get the best of the care that they can get from the hospital. So that is why we have to work as a team. So the nurses has a significant role to play during the doctor's ward round because, as earlier mentioned, the nurses stay with the patient 24 hours, and the ward that they conduct provide them with the information that the doctors cannot extract from patient during their own ward round. Like we've earlier explained, there are certain information that it is only when the nurses move around, because they stay 24 hours with the patient, then they can get such information.